The Greens and the Independents, Bandt and Richard Natale are there now.
Thank you very much for coming today. Look, today's a terrific day for the health of the Australian community. We're going to see two important changes to the health system come to pass. We're going to see the private health insurance system become much fairer, and we think that's a good thing. The Greens have always been very strong supporters of means testing the private health insurance rebate. And importantly, we're also going to see a significant investment in dental health, $165 million going towards the dental health of low-income Australians who at the moment can't afford to access private health insurance, are on waiting lists and often defer treatment simply because they can't afford it. So it's a terrific outcome. It's a great outcome for the Australian community. We're really pleased to have entered into what have proven to be very fruitful and productive negotiations with the government. Over recent weeks, it's become clear to me through our negotiations with the new Health Minister that she has an ambition to achieve reform in the area of dental health. It's a shared ambition. The Greens, as you know, for a long time have campaigned on universal Medicare-funded dental care, and I think today's announcement brings us one step closer towards that important goal. So it is a terrific day for the health of particularly low-income Australians. It means the health system's going to be a little bit fairer. As a result of those productive and fruitful negotiations, and as a result of achieving what I think is a great outcome, we have agreed to, that is the Greens have agreed to pass the government's private health insurance reforms unamended through both the lower house and the Senate. And I will say that none of this would have been possible without the important presence of Bandt in the lower house. It just shows you how critical it is to have that voice in the lower house, and the people of Melbourne will now be saying to themselves, that's how powerful our vote was. We managed to achieve some important reform in the area of dental health, and it's a result of the work of Adam and, of course, all of us in the Senate, and is also a result of the fact that we have a new Health Minister who does appear to have a shared vision on this ambitious project, which is to achieve meaningful reform in the area of dental health. Perhaps I'll hand it over to Adam, and Adam can say a few words as well.
Thanks, Richard. Look, just on 18 months ago, as Bob Brown and I were sitting down with the Prime Minister having discussions about forming government, one of the items that we put on the table was reform of dental care in this country. The Greens are about people. The Greens believe that going to the dentist should be like going to the doctor, and the Greens want to see dental care become part of Medicare. We had a written agreement to begin that process, and now, some 18 months or so later, we've had real progress. Thanks to having Greens in both Houses of Parliament, we now have a $165 million down payment on getting dental into Medicare. This is a fantastic result. Because we have Greens in both Houses of Parliament, the Australian people benefit, and it is better for the health of the Australian people. So I'm really pleased with this outcome, and I think it shows what happens when you have constructive negotiations and agreements that are adhered to. I think it's a very good outcome.
The amount of money you secured is nowhere near the amount you wanted. What happened?
Let me just say that we do consider $165 million a significant amount of money for dental care, and those people who can now go to the dentist who couldn't afford to do so previously will be grateful. But you're right, it's not enough. More needs to be done. This, as far as we're concerned, is the start of a negotiation with the government.
Okay, unfortunately, we're going to have to leave that there now. That was the Greens MPs Richard Natale and Bandt live from Parliament House in Canberra, and before them the Health Minister Tanya Plibersek with a significant announcement on the private health insurance rebate.